Hi everyone, welcome to the Oldish TV. A physician has written an article in a major newspaper this past weekend that suggests that our hospitals are not prepared for what might be an outbreak of the coronavirus. How does that relate to you? Well, let's take a look at that article and I will show you exactly how it relates to you. My name is Karen Brown. I'm the publisher and editor of The Oldish, and it is my pleasure to welcome you here today. Let's take a look at that article. There it is. Dr. James Simpson is a family care physician in Perth County, and while he writes the article about Ontario hospitals, I think it applies across the board because every community is facing the same issues. Now, the major crux of this, and the thing that caught my eye, was down here. The acute care beds are all blocked up, and the reason that they are blocked up is due to the lack of availability of long-term beds. He writes, we had 30 patients out of 85 total beds admitted to hospital who are designated ALC, alternative level of care. Patients who have no acute medical issues but cannot be discharged home safely and are awaiting placement in nursing homes or similar facilities. Because of this, we are over capacity. You know, the arguments have long been going on about hallway medicine. This is the issue. In the next paragraph, he says, furthermore, in the event of an outbreak of coronavirus, understand that could also be the flu virus. It could be any outbreak of anything. These ALC patients are sitting ducks. They do have significant health concerns and would be highly vulnerable to a serious viral illness. Now, although we can't control the availability of long-term beds, and I completely get it, they're not building long-term care facilities and nursing homes the way that they used to. The reason is, if you look at the demographics 50 years out, you will see that there's going to be a spike in older adults and then it drops off. If you look now at our birth rate, it's declining. If you look at 10-year-olds, 20-year-olds, 30-year-olds, they are less in numbers. So eventually that peak is going to level back off again, and they're going to have a bunch of buildings with no use. Kind of like the problem is with schools these days in many rural environments, and actually in cities too. They're integrating schools, they're integrating hospitals in the same way because, you know, the budget just is not there to accommodate all of the people. The needs of the patient population are changing. They are needs of a more elderly group of people who can be seen within an acute care setting and then released, except they can't because there are no beds. Now, home care. Yes, we need more home care workers. Yes, they need to be trained properly and they need to be paid respectfully. They are not at this point in time. So it tends to be a rather transient job. That's not something we can control either. You notice in the article that he said they could not be discharged home safely. That is what you can control. So we're going to talk about that. You know that we've talked about universal design principles here in the past. Never has the need for attention to this been stronger than right now. So if you are 40 years old and you are watching this, if you are 60 years old or 80 years old, it doesn't matter. If you are a 40, 50-year-old and you've lived in your home for a few years and maybe it's looking a little tired and you think you might want to do some renovations, I urge you to consider doing your renovations with universal design principles in mind. Now, many people know design principles as accessibility. Accessible designs are, in fact, universal designs. It's the same thing. And many people think that if you design a home using the principles of accessibility, that it's not going to be attractive. Nothing is further from the truth. I guarantee you, nothing is further from the truth. Now, if your budget is on the lower end, You can do things a bit at a time, but you can still have a beautifully designed home. In a few weeks, I'm going for a tour of a factory where they make grab bars that look nothing like grab bars. You would never know it. So I'm going to show you some of these things as we move along, but I want to talk today about the idea that you might be considering renovation. And if you are 60, 70, 80 years old and you know that you want to stay in your home for as long as possible, then you need to make sure that your home works with you and not against you. So you might like to look at some of these areas of your home and consider building a bit of a budget to do something about it. There are two main areas in any home that are the most challenging. The first is entry. Just getting into your home can be challenging for the vast majority of people. If you're in a wheelchair or using a walker, or even a cane for that matter, I mean, mobility is an issue for many older people. You need one door that is zero entry. That means you can walk from the outside to the inside without a step, without having to step over anything, and you are right in the main living area where presumably your kitchen, your washroom, and your bedroom are located. So how do you do that? Well, you need to talk to a contractor or a renovator who knows exactly how to do this, because you have to bury the bottom of the door frame as well, and you need to accommodate the fact that snow and ice, if you live in a four-season environment, you need to make sure that that can't get in. Now, about 1/4 of an inch is the only rise that you can successfully use and still get into the home if you yourself are in a wheelchair. 1/4 inch isn't very much. Is it doable? 100% it's doable. I've seen it. 100%. Okay, so you've got the entry taken care of with zero entry. Now, if you are somebody who lives in a home that is perhaps built into a hill and you need to use a ramp, there are solutions for that as well. You've probably seen ramps in your community or even your neighborhood. Ramps need to be built by somebody who knows what they're doing. You can't have a steep ramp because, well, that clearly presents problems for somebody who is on wheels if the ramp is too steep. The actual recommendation is 1 inch of rise for every foot of ramp. Now that's the maximum. If you can do it less than that, that's better. That's often why you see ramps that kind of zigzag, and they might actually have 3 components to them, 3 legs. That is something that you need to talk with a contractor about as well, who knows what they're doing. Do contractors ever build ramps that are too dangerous? Yes, they do. Because you say we need a ramp, they build you a ramp. They don't really know what they're doing, so you need to talk with them and make sure you find a contractor who does know what they're doing so that you can safely get in and out of your home in all 4 seasons. Remember, if there's ice there, that slope is going to matter a whole lot more. Okay, you're in the house. Let's talk about bathrooms, because they are the number 2 most difficult thing for people to design around. If you already have a bathroom on your main floor, great. Even if it's a 2-piece bathroom, great. The plumbing's there. You might need to steal space from an adjacent room to make it large enough, but what you're looking for is the ability to take a wheelchair or a walker in there and turn a complete circle comfortably. And if you need the help of a caregiver, you need to accommodate the fact that that person is with you as well. So somebody pushing your wheelchair, there needs to be space for them to turn. The whole unit has to turn. And of course you need a sink that you can get a wheelchair under. So it needs to be a bit lower than normal. You need to be able to fit the wheelchair under it, so no cabinetry there. You need to have a toilet that is a higher toilet with grab bars beside it to allow for the transfers. Here's the most important part that people can get stumped on. The shower. You need to be able to roll your wheelchair into the shower or your walker. Now, for many renovation projects, they have designed a large shower that a walker or a wheelchair can fit into, but you need somebody to actually push that wheelchair over the lip, which they put there so that the water won't spill out onto the bathroom floor. My friends, that is not an accessible shower. An accessible shower has no such lip. It has a slope from the bathroom to the drain. 1 degree is all you need. However, it does mean that the floor has to be dug out so that it can be done properly. So let me say this again. An accessible shower is a 0 entry, no lip. You can roll right in from wherever you are in the bathroom. That is the second piece. The third piece that I'm going to touch on is the kitchen. You need to make sure that counters are low enough that you can get your wheelchair under them and still do the work that you have to do safely. You need to make sure that you can reach all of the appliances safely. So that means that with a stovetop, the controls have to be along the side or along the front. That means that if you use wall ovens, you need to have something called a chef's oven. So that is one that opens this way, not with the door that swings open. Because imagine if you're sitting in a wheelchair and you're confronting this oven and the door comes down, there is still a very hot door between you and the contents of that oven. So the chef's oven, yes, there are a few of them around. They're not made by all manufacturers, but your appliance provider should be able to access a chef's oven for you. If they can't, move to another store because they do exist. I've seen them. They open this way. Usually you just need one hand because the other side, when you open the right side, the left side automatically opens, or vice versa. But that is something that you will need if you are the person who makes meals or if you like to cook at all. So a lot of these things are absolutely doable. A chef's oven looks just as functional as any other oven, and it doesn't look out of place, but it is universally designed, right? So what I was telling you earlier about using universal design principles everywhere, it doesn't mean that your house looks like it's designed for somebody who's disabled. It can still be beautifully designed. Your bathroom is going to be the large, beautiful bathroom that everybody wants, every woman anyway. Everybody wants a beautifully designed bathroom, and it's doable, and it will not look a whole lot different than a regular bathroom. Nobody's going to imagine that there is anything about this that looks like a hospital, which is everybody's fear. You need to make sure that you are dealing with a contractor renovator who understands exactly what you need and that you're speaking the same language. Too often, you're not speaking the same language. There's a disconnect. So you can spend a lot of money to end up with something that isn't really functional the way you need it to be. There are design principles published for every major city in Canada. If you can't find them, I know a guy. You can private message me, and I actually know of a person who works with accessible/universal design everywhere in North America, and I can hook you up with him. Not a problem. But it's important that you spend your dollars efficiently. That means you need to be talking to a contractor or a renovator who speaks the language. But you have to speak the language too. So make sure you do your homework. If you are undertaking renovations in your home in the next little while, no matter how old you are, I would urge you to consider using universal design principles so that your house works with you and not against you. That means that if you're one of those people who ends up in hospital with some kind of an illness, you will want to be discharged into your own home, and you want to make that as possible as it can be by having a home that is ready to accommodate you. I will leave you with that this week. Thank you for joining us here on the Oldish TV. I welcome you to join us next Wednesday at 12 noon for another edition of the Oldish TV. Be sure to leave your comments below. I'd like to know what your thoughts are. I always like to know your thoughts. So until next week, do take care of one another, and remember that it does take a village to age a senior.